Donning. How to safely put on personal protective equipment, or more commonly known PPE. We will demonstrate ways to appropriately put on or don PPE. It is important to receive training, demonstrate competency, and practice the Medical City's donning procedure. Preparation. First, identify and gather proper PPE to put on, including an appropriately fitted isolation gown, a NIOSH approved N95 face piece respirator or high level respiratory protection, or a face mask, a face shield or goggles, and a pair of disposable patient examination gloves. Perform hand hygiene by using alcohol based hand rub or by washing your hands with soap and water for at least 20 seconds. Then, put on isolation gown. Tie all ties and snap all snaps. You may need assistance from another healthcare provider. Put on the NIOSH approved N95 respirator mask. When using a respirator with a nose piece, fit it to your nose using both hands. Do not bend or tent the respirator. Extend the respirator under your chin, protecting both your mouth and nose. Pull the top strap over your head, placing it on the crown, and then pull the bottom strap over your head, placing it at the base of your neck. Lastly, perform a user's seal check. Do this by using your hands to cover the surface of the respirator and gently exhale, checking that the face piece bulges slightly. Then, while keeping your hands over the respirator, take in a quick, deep breath, checking that the face piece collapses slightly. If air escapes through the edges, readjust the fit of your respirator and perform another user seal check. Do this each time you put the respirator on. If a respirator is not appropriate for the patient's case, put on a face mask instead. Extend the face mask under your chin, protecting both your nose and your mouth. If the mask has loops, hook them around your ears. If it has ties, secure them at the base of your neck and crown of your head. Next, put on face shield or goggles. Lastly, put on your gloves. Pull the gloves down so that they cover the wrist of the gown. You are now ready to enter the patient's room. Doffing. How to safely take off personal protective equipment, more commonly called PPE. We will demonstrate ways to appropriately take off or doff PPE. It is important that you receive training, demonstrate competency in removing your PPE without contaminating yourself, and practice the Medical City's doffing procedure. Before leaving the patient's room, remove and discard your gloves. Gloves can be removed using more than one technique. For the glove-in-glove technique, pinch the outside of the glove near the wrist. Peel downwards, pulling the glove inside out. With your ungloved hand, slide your finger under the back wrist of your remaining glove. Again, peel downwards, turning the glove inside out. Discard the gloves. For the beaking method, pinch the outside of the glove near the wrist. Using your finger, pull the glove inside out and over the fingers and the thumb to form a beak. With the beaked hand, pinch the opposite glove at the wrist and pull downwards, turning the glove inside out. With the ungloved hand, pull the beaked glove off, touching only the inside of the glove. Next, remove your gown. Untie all ties or unsnap all snaps. Some gown ties can be broken rather than untied. In that instance, break the ties gently, avoiding a forceful movement. Reach up to the shoulder's inner side of the gown and carefully pull or roll the gown and away from the body. Dispose of the used gown. You may now exit the patient's room. After leaving the patient's room, perform hand hygiene by using alcohol-based hand rub or by washing your hands with soap and water for at least 20 seconds. Be sure to clean your wrists where the edge of the glove was located. Carefully remove the face shield or goggles by grabbing the strap and pulling upwards and away from your head. Do not touch the front of the face shield or goggles. Next, remove and discard the respirator or face mask. If you are wearing a respirator, remove the bottom strap by grabbing only the strap and bringing it carefully over your head. Grasp the top strap and bring it carefully over your head, and then pull the respirator away from your face without touching the front of the respirator. If you are wearing a face mask, carefully untie the straps or unhook them from your ears and pull the mask away from your face without touching the front of the mask. Lastly, perform hand hygiene after removing the respirator or face mask. You have now completed the doffing procedure. For more information, contact Hospital Infection Control and Epidemiology Center at hicc@themedicalcity.com or at 0917 176 4422.